Hi there, this is Connie Welch with LifeBeyondHepatitis.com. This is the week video update for week 19 of triple therapy treatment for hepatitis C. I've been using the protease inhibitor Incivek along with PEG Interferon and Ribavirin. I began treatment on April the 9th, 2012, and as of today, I've been on treatment for 20 weeks. Monday, I completed week 19, and now I'm into week 20. So very excited about that. Wanted to give you a quick recap of treatment. I am genotype 1, and hepatitis C has been living with me for 20 years, and this is my third treatment. Treatment this time has been very different, and we've gotten very different results this time and had great success. And I wanted to share with you week 4, week 12, and week 16, I have had consecutive non-detected virus load counts for the virus. So we're very excited about that because the treatment is working. So just couldn't be more happy about that. I saw my doctor this week, and he informed me that with having 3 consecutive non-detected virus load counts and with all of my other blood work, my liver enzymes right now are all in normal limits. Everything else is improving in my blood work, and taking it into the consideration of tolerating the treatment side effects. The treatment is just working and it's looking good. So the protocol for my virus strain, which is genotype 1, and these sort of results is 24 weeks. So my treatment will officially end September the 23rd. So I am so excited about that. That is great. And so we cannot wait. So, you know, all along we have felt like this has just been a climbing a mountain. And so I am seeing the peak in view, and I'm very excited to get to the summit. Also, I wanted to just kind of tell you that my doctor and I had discussed some of my recent side effects that I've been dealing with, which is I've had more of a drop in energy lately, really experiencing a lot more fatigue. I've had to lay down more and take longer naps than what I've had lately. And also I've had extreme dry mouth. My tongue has got white patches on it and very rough. And then I've had no appetite and kept a persistent dry cough. The doctor feels like these are just continued side effects of the treatment. And we're so close to being through, only have 4 weeks left, so we just have to persevere through the end. But he did give me some suggestions to help with some of these side effects. Number 1 for the dry mouth was using Biotine. Let me see if I can get this shown on the camera. Biotine is an oral mouth rinse. You just buy it at the drugstore, and it's very helpful for dry mouth. And it has already helped to improve some of those symptoms for me. And, you know, if you're on a lot of strong drugs like this treatment is, you can tend to feel very dry. My skin feels very dry. My mouth feels dry. Right now, I just feel like all the moisture's been just being sucked out of my body. So I'm trying to stay hydrated with drinking lots of water and trying to do the things that I can, you know, lots with lotions and things like that that will help alleviate some of those dry symptoms. Also, we discussed, taking an extra multivitamin and some extra vitamin C to kind of help boost the immune system, along with the B12, which also helps with the energy. So just been doing that and trying to just take some things for allergies to help alleviate some of the symptoms of that. And the main thing is doing precautions. Here in the North Texas area, currently they're experiencing some cases of West Nile virus. So the doctor very much cautioned me not to be out between the hours of 4 and 8 p.m. because that's generally when the mosquitoes swarm and are worse. So just been trying to take some precautions with that. You know, I feel like we've gone so long into this treatment for the long haul, and just don't want to do anything to put myself at risk or danger of interrupting the treatment early. So, you know, I know your doctor may have told you too, just to be careful not to be around people that are sick, Try to take extra precautions with extra hand washing and things like that you can help prevent, getting extra infection or getting sick, because that does affect how you feel and treatment. So give yourself the very best possible. Also, I'm scheduled to do more blood work next week, and then at the end of September, we will do another big round of blood work, which will include another virus load test, and then we will follow up every 3 months doing blood work, and I'll be monitored and my progress with that. So I feel very good about that. My doctor and I, we also discussed how long do you know is really long enough to be on treatment, because you've got so much invested in treatment and you are in it for the long haul. And even though you're ready for treatment to be over, treatment itself can become like a security blanket. So it's you have to just really take into account your type of virus strain and your blood work to know what sort of results that you are getting on your blood work and the side effect treatments and how you're tolerating those. And the protocol for your type of virus strain, your doctor considers all of those factors in, and to know when is the right time for treatment to be completed for you. For me personally, I have known always that God has gone ahead of me and prepared every step of the way of this journey, and He is the one that's in control, and He knows exactly how many days that I need to be on treatment. And He's also given me a great peace with my doctor. And so I feel a very much a great peace about September the 23rd being the end. And so just very excited about that, and just couldn't be happier that this treatment is working. So wanted just to share with you this week's update and hope that you're having a good week. Feel free to write me or get on the website lifebeyondhepatitisc.com and ask me anything that you'd like. I had a viewer write me from this last week, and I wanted to answer her question. She had asked me, do you usually start feeling right away treatment side effects, or does that normally take a little while? And for me personally, I was using the Incivek, using the peg interferon and the Ribavirin, and I started my treatment on a Monday. So the Incivek and the Ribavirin are pills, and the peg interferon is an injection that you do once a week. But that first day, I did not feel too terribly bad that first day. That evening was when I did take the interferon shot. And that's generally when I began to start feeling more of the side effects come on. With the shot, you tend to have more flu-like symptoms. And so muscle aches, low-grade fever, possibly some headache, and some nausea, waves of nausea can come and go. I have heard some people that didn't deal with that. I personally did, but I had medicines to help alleviate some of that. And as far as some of the side effects from the Incivek, I did get some preparation H and some creams and suppositories that would help alleviate some of that rectal burning and itching. And I had those on hand along with some of the Charmin moist wipes, and those helped as well. It just takes some time. I think everybody is a little bit different, and I've heard some people dealing with side effects a little bit easier, and I've heard some who had it a little bit more severe. So it's really an individual thing, but I would say within a day or two, you're probably going to start feeling the effects of the medicine and taking effect, and you'll definitely start noticing your energy levels and things like that changing. But take heart, because just know if this medicine is working, it's like an army that's at work for you, and killing the hepatitis C cells. And so there's battle going on, and you are a very important part. You are a Hep C warrior, and this is what you need to remember, that while you're in battle, and you're going to have cycles of dealing with side effects, but it has been very much proven to me that side effects will cycle out. So if you're feeling something currently, it's not necessarily going to just stay that way the whole time. You just have to ride it out and be patient. And I've got to tell you that it just seems like yesterday when I started treatment, that treatment seemed to go by so slow at the beginning. But it has picked up speed, and now I just can't believe that here I am into my last 4 weeks. So I'm very excited, and I just want to encourage you that you too will get there and stuff, and you will be able to finish and to be able to be a conqueror for this disease. So stay tuned for my next video update, and I hope you check out the website, lifebeyondhepatitisc.com, and feel free to contact me, and I will help you any way I can. And I look forward to talking to you next week. All right, bye-bye.